right. Everybody, in the year 2000, I traveled to Steubenville, Ohio, to help the Jefferson County ADMH Board close 6 group homes. At the time, I had no idea that my life would change forever from that visit. After seeing that, I got involved with the adult care facilities, and we began an organization of home operators, and we created the Ohio Adult Care Facility Association. NAMI Ohio Board of Directors visited over 100 homes and found that 80 of these homes were very nice. 20 were not very nice. The association was created, and I became the first executive director of that organization. For the next 24 years, Marty Phelan, a home operator from Dayton area, served as president. At our first meeting in 2000, Marty, his brother Mike, and his mother Nell all walked into the NAMI conference room and introduced themselves. As an association, we knew only one way to enhance quality was to increase the revenue that these homes were receiving. Our motto was more money. With Marty's leadership, that happened. We got more increase in RSS. We've been getting grants now, getting money, still not nearly enough to provide the quality of care that we want. But without Marty, it would not have happened. Last year, Marty decided to retire out of the mental health adult care facility business, and I'm waiting for him to invite me down to Virginia to go fishing on the river next to his campgrounds. I haven't heard you call, I just need a call, and I'm going to be retired. Marty, many times it was frustrating facing the roadblock after roadblock after roadblock, but I'm positive that your work with the association and the fine homes you operated in Dayton and the homes that your mother operated in Dayton has helped hundreds, and your brother in Dayton helped thousands of people or hundreds of people live in better lives. One last story. First time I went down to Marty's place, I saw a number of urns on the fire mantle. One had the pictures of Cincinnati Reds all over it. One of Marty's residents passed away, and he put his ashes in a Cincinnati Reds urn. That's because he respected that man and he loved that man as a family man. He was part of Marty's family. Marty, you should have received this award a long time ago. This year's Adult Care Facility Champion of the Year award, Marty Phelan. Marty loves to speak publicly, so.
No. Terry, thank you for this. I look back at the last 24 years that we've spent together, and it's been amazing. It really hasn't been work. It's been an adventure. It really has. We've loved what we've done over the years, and I look forward to still helping my brother Mike and stuff. And thank you all for this. I appreciate it.
NAMI Ohio is extremely pleased to have our NAMI on-campus affiliate, Central State University, here to present today. All of us in this room recognize the significance of supporting our youth who are vulnerable to mental illness. This affiliate has a number of programs that are so exciting for the NAMI movement. I would like to introduce Dr. Sonia Hunt, Director of Counseling Services at Central State University. Thank you. The podium is yours, Madame.
I'll stand here, that's fine. Good afternoon to all of you. It is certainly our delight and our pleasure to be here today. To Mr. Terry Russell, God bless you in all that you do, and our prayers that you will enjoy your retirement. NAMI has been our #1 supporter for our mental health efforts on our campus, but I can't stand here today and take credit for this. Before me, Mr. Victor Adebola served as the Director of Counseling Services. He was here this morning. I don't know if he is still here. Mr. Adebola, you did a wonderful job handing off the program, and I want to say thank you. In addition, our program manager, Ms. Frances Robinson, who is really the neck and the axle of our counseling services, if you would stand. And certainly our students, they have prepared a very robust presentation. This is who we are. This is what we do. And to assist us, we have Charlton & Charlton, who has partnered with us for the last 3 years, and we are so excited. They are dynamic. We know that you all will enjoy. If you give us 18 minutes, we promise you we will be done. But I want Brittany Trice, a senior social work student who has served as our NAMI president for 2 years, to come because she has some presentations that she would like to give away.
Hi, my name is Brittany. I would like to thank Dr. Jack Thomas, our president, and also I would like to thank Terry and Angela for all of their support. We have some gifts for you guys, so can you come get them?
Thank you so much.
You guys are officially Marauders now, so thank you. Yeah.
Hello, everyone. My name is Richard Wright. I am a senior from Central State University and a communications major from Columbus, Ohio, right here.
Hello, everyone. My name is Tiara Bullock. I'm from Chicago, Illinois, and I'm a freshman communications major.
And so we want to just first do an introduction. We are the co-directors of a production that NAMI from Central State University really called on us to do, called Healing Through Expressions, that they've been doing for the past about 3 years. And so at the beginning for about, I think February, they asked me to, Ms. Hunt, Dr. Hunt, which is our advisor at NAMI, she's really, as you saw, has a lot of energy. She came to me and said that she really wants to really present this for the student body at Central State University, which is a great HBCU. And at first, I'm like, oh, I don't really know how to do this. But I started really thinking about our student body and how our campus is really ran. And so our campus has a really creatively expressive tone to it, which they love spoken word, singing, poetry, rapping, all art of that sort. So I wanted to do a program or production that's not necessarily just skits, but we also convey a mental health message through expressions as our creative, like spoken word, poetry, and everything. So Healing Through Expression is really messages going from the dark to the light, which represents that we all have went through mental health problems and everything, which we feel like we are alone and we are in the dark. But we came to show you that we are here with you, and also that there is a light, there is a promise at the end of the road, and that there are resources and people that can help, just like you all, that can help and that bring us to the light. So through poetry, singing, rapping, acting, and just a little humor, we got the message out, and I think that our student body really connected and loved what we did. So.
So I've worked with productions and stage crew for a couple years now, and one thing I've always learned is a production is only as strong as its crew, and we have a very versatile crew here. Our actors, they sing, they play the music, they bring props. I mean, no one here has done a single thing. Alyssa, Sir, Lo, those three amazing people over there, they came here today past the time where we were supposed to be out back in our houses from our dorms. We were supposed to be, the university was ready to kick us out yesterday. But every single person here took the time to come here because we are all so passionate about mental health and creativity. And we hope you guys feel as passionate as we do about it after our production today.
So we're gonna start and do excerpts from our presentation, not the whole full thing, but many excerpts and scenes. So then we're gonna do it without the mic. We should be able to express ourselves and project really well. So we just ask everyone to be quiet to listen, and it will get deep. It will get real, and I think that's what mental health is. We want to show the realness. Want to show what mental health really is like, and then also it's going to show promising and show the end and show resources and how having peers and people to help you can really help. So again, we present Healing Through Expression. You can turn this mic off too.
You know, one thing I've experienced is loving the Lord gets real complicated. You know, I look at myself today and I think, man, you make all these great miracles. You have all these great fables. You walk across water, bless somebody's daughter, and I swear, wasn't it your son who died for our sins? So why the heck am I the one being punished? What karma hit so bad I go to school just to get dragged with my bag? It's the baggage. It's the glorified and most high wreaking havoc. You know, maybe a bad habit. Or a messed up attempt at creating a living, breathing, but feeling symbol of everything you cast out. Well, heck, you could cast me out. You could take me now. You can end this lonely peril so you'll never have to hear me pray again. I'm tired. I'm beat and I'm tired. You're a liar. You missed me with that lighter. Please set me on fire. Just walk through that door just to hear nothing right. Got down on my knees just to hear nothing right. You won't let me bleed. You won't let me choke. You won't let the bullets relief of my soul. Yeah, I am not breathing. I am choking. I'm constantly being suffocated. Your answer ain't never fixing it. So hear me now, Lord. Loving you is so complicated.
How was that football game, dude?
The football game, bro. Honestly, I think it was good, but they should have ran the ball more. You feel me?
I mean, I guess you're right.
Like, honestly, if we would have ran the ball more, everything would have been.
I'm sorry.
Whoa. What's going on?
I'm so sorry.
You're sorry?
I'm sorry.
Don't worry.
I'm sorry.
You look sorry. But you're not sorry you bumped into me. Right. You're sorry that you exist. You're sorry that you're a natural burden. And actually, to excuse you, you search for an excuse. An excuse to prove your importance, to prove your worth. And the saddest part about that is, I don't even care. Not even enough to ask your name. Got my way.
It does. And plus your name Penny, because you're worthless.
Yeah, I'm thinking about to go to, have my class, I think about at 6, but I'm not sure. It's really a late class, but I'm on the way there anyway.
I'm sorry. I'm sorry.
No, it's okay. Hey, how,
Please,
do you want to?
please stop. Please.
I just wanted to see if you hang out. So from we're still going on, but just to give you context, that the first scene was her. She was in her dorm room alone, which represents just mental health, how our thoughts can really take over, and the flag represented her thoughts and everything, the woman that was around her in that room. It got real dark, scary, and that's how it really is. Mind you, in the room, in real life, it could have been nothing going on, but that represents her thoughts. It represents how chaotic things can be. Then also, we want to represent how, as college students, when you have mental health problems, that you can deal with it alone, but you also have to. You have to get a degree. You have to go outside. You have to work. You have to really face reality and face everything, mental health problems that's going on with reality and everything. So that's what this was, walking in the hallway and seeing how everything affected her and how people that's on the outside looking in don't really know what's going on with someone's mind. So we'll continue on.
Hello. My name's Penny. Penny. So I recently went to the counselor's office, and they told me that if ever I need something, to just ask for it. So I'm gonna try it out for you guys today. Hi, my name is Penny. Hello, can you hear me? My name's Penny, and I really need some help. Hi, I need some help. Could you please help me? Any of you, could you, please? I know I never speak, it's just, well, you, how about you? You always seem so nice. I know you won't look right through me. I just, maybe don't look through me, but maybe look through this thick brick covering this sadness and store this cloud that hangs over my head every day. Please just hear me. Don't walk away. Don't just leave me here. I want to stay. I finally am speaking up. Listen. I know I'm just another sad story, but a sad story still deserves reading, and I'm not asking you to fix me. But maybe just take a second. Take a look in. Just please help me. The counselors also said that whenever you need something, be sure to affirm yourself and always smile and say please. Please help me. Please put the cherry on top. Please, if I wait a while, please, what if I keep asking and I will never stop? I could schedule a counselor meeting, I don't mind. I could wait a while. I'm screaming, please, looking up, thinking he'll make you help me. Hands pressed together, and I still scream, please, please, please. I smiled nicely. I begged tirelessly. I prayed honestly, but where does this get me? Where? Maybe. Please help me. No. Help me, please. Help, please me. No, I'm sorry. I didn't mean to say it that way. I don't know how else to say it. Is there something wrong with the way I said it? But it also wouldn't be the first time I tried it.
So we're going to the second act, and this is called the Helping Hand Scene, and hopefully things will turn around.
I'm telling you, the Lakers will be better without Westbrook.
No, whoa,
He's not good for the team. He's not good for the
you
team.
got it.
That's Mr. Turnover.
But, okay, think about the stats. Think about the stats.
Wait. That's she's crying.
No, don't start this. Please don't start this.
You want something else? I don't know.
I got an idea.
Okay, all right. Let's hear him out.
All right, what's the idea?
I think that we should go help talk to her.
Talk to her.
Nah, man.
Bro, she's wearing all black in 90-degree weather. She clearly lost her mind. Do you help a hitchhiker on the side of the road? Do you?
I'm just saying that at all points in her life, we have been alone. And I think for one time that we help someone else for a change. You're right. I think that we would benefit us if we help someone else and that we don't let her be alone. So, you guys are with me? Are you with me?
I don't know.
Wait, what?
Please, we've been through that before. And I hope you, so can we please just go over there and help? For me. For me.
I guess we go over there. I don't know what you see in her.
Bro, you just saying that because you like her, bro. This is dumb.
Hey, I'm saying the same thing. Come on. All right.
Bro, I'm going to go, but I'm not helping, bro. I'm not fulfilled.
How you doing?
We all.
Don't look at me. I'm just here, Matilda.
We all.
Wait. Please.
I promise. We all came to help and just to make sure that you're okay and to tell you that we are here for you.
Yeah.
And we all came to help. So
Oh my God, this was great. She was lost, but now she's found. Can we go?
Whoa. You can't be on all that extra energy with her. Why? Because you was in the same place.
Nah,
You remember when you used to sit alone as a freshman and I was the only one to talk to you?
Okay.
Big Stacy used to bully you for watching anime.
Bro, we don't talk
Oh,
about
wait,
that.
no. She used to rip the pages out your notebook, too.
Bro,
You
why'd
see where
bring
she
that
was
up,
at.
bro? Why'd you bring
You
that
watch
up?
anime?
He do.
Yeah, I watch anime, man. What's your favorite one?
Sailor Moon.
Sailor Moon. Sailor Moon. That's alright, I guess. Like, that don't really mean too much to me, honestly. Like, anime is not even that bad.
See, we all, do some peculiar things. I don't really like anime, but I like blue cheese, and that's pretty weird.
Yeah.
So,
Bro, what?
I put hot sauce on chocolate.
Bro, what?
I like it. I'm sorry. But
Oh, okay. So we're all just a bunch of weirdos, apparently.
Hey.
All right, okay. Listen, I still don't like you. I don't know you. But that's the problem. I don't know you, so I can't dislike you. So if I had to give you some advice that I would have taken when I was in your shoes, that I would tell you that you gotta know your self-worth. Sometimes you gotta put yourself first. I know you got love for so many, more than plenty, but if you neglect yourself, it's gonna hurt. You gotta know your self-worth. Sometimes you gotta put yourself first. I know you got love for so many, more than plenty, but if you neglect yourself, it's gonna hurt. They say no pain, no gain, but if you take away the good times, then who remains? Everybody not on your side, they ain't on your mains. When you felt down and out, think about who came to your side. Like I got yours, you got mine. Respect each other, help each other grind. On a thin line, but still they made time. We don't want somebody like that at the drop of a dime. But me, I'm like that every week, day and hour. If I'm feeling weak that day, I still harvest the power to help scare friends out. I don't like to know that you cower while I'm washing in my sins like it's a holy shower. And I know your heart, all you want to do is help, but you can't help others. If you can't help yourself, you put yourself in too much heat. It'll make you melt. Everybody don't feel the same energy you felt, so you gotta know your self-worth. Sometimes you gotta put yourself first. I know you got love for so many, more than plenty, but if you neglect yourself, it's gonna hurt. You gotta know your self-worth. Sometimes you gotta put yourself first. I know you got love for so many, more than plenty, but if you neglect yourself, it's gonna hurt. It's a game of chess, so don't be a pawn. Be like a knight, jump obstacles, try to avoid harm. See different pathways, so you can report and warn the castle of invasion, so they know the timing that you want. But more than that, you're valuable like the king, so if you collapse, then you pay too much of a cost. And you're powerful like a strategic advanced queen, but if you can't protect the king, then you still lost. What I'm saying and conveying is that you can't be used. Know yourself, know your beliefs, and even know your truth. Never let the demons of temptation grab a hold of you. Hold your head high so you can have an open view. Love ain't distributed evenly. Accept that these are real world occurrences. Don't neglect that. Respect yourself so you can get that respect back. If someone cross the line, then you have to go correct that, cause you gotta know your self-worth. Sometimes you gotta put yourself first. I know you got love for so many, little penny, but if you neglect yourself, it's gonna hurt. You gotta know your self-worth. Sometimes you gotta put yourself first. I know you got love for so many, little penny, but if you neglect yourself, it's gonna hurt.
see, I mean,
see?
So as you guys saw, my story started off pretty bad. You know, I always took real offense to my name, but my name doesn't make me worthless. And you never know when people are gonna come into your life that you never expected to come. Sometimes it's your worst enemy and sometimes it's your best friend. This time it was people that didn't even notice who I was. They came out to be people who ended up saving me in the end, and that's something you can never expect. So I thank these guys here today. And after this, we're gonna all go get ice cream because it's time for that part of my life to start and the dark phases of the past to end.
Stay here. What do you think? You know, when Angela and I first went over to Central State University and met with the advisors and the kids, it might have been one of the neatest meetings I ever had, because they wanted to do something. And one of the things that they were doing, and I tell everybody this when I go around the state, taco night. Let's talk about it, or let's taco about it. And they go in the dorms and have taco parties to talk about things. That's a NAMI affiliate, campus affiliate. And this is our future, people. We had a board member for years that I fell in love with. I loved Reverend Dr. J. Donald Mosley. He was a long-term member of NAMI, Ohio, and he was one of the kindest men I ever met. For over 25 years, he would travel Saturday night from Cincinnati, Ohio, to the suburb of Pittsburgh to provide a service for a church, a small church. 25 years he did that for a small congregation. To know Reverend Mosley was to love Reverend Mosley. Today we have his wife, Glennie Mosley, is with us, and we have a presentation to make. Do we have and I may pronounce this wrong, Samora Abernathy? We have a Samora Abernathy. Come up here, Samora. This is a little surprise to Samora, if you can't tell. Samora, you're going to be the first recipient. Reverend Mosley, when he passed away last year, left a little money to NAMI, Ohio, and we decided to put it into a scholarship fund. And so, Samora Abernathy, you're going to receive a $5,000 scholarship to pursue your career. Samara is going into social work, and the only condition is you're going to get into mental health work. Okay, come on over this way, and I think...
Oh, this way.
Right here. I think you got something to say, right?
Oh, he said, you got something to say, right? Yeah, I have something to say. Good afternoon. I won't be before you long. My husband became acquainted with the mental health facility, CCHB in Cincinnati, Central Community Health Board, where he met Sandra Driggins-Smith, as well as Miss Gloria Walker, and then later on, Mr. Terry Russell in Columbus. And everybody likes to laugh, so y'all can laugh at this. See, they put Gloria up in one of them hotels, you say, they paid by the hour. So I would go to the board meetings with him, and they met at a Holiday Inn down by the bus station. And I would sit in the lobby while they had the meeting, and I got propositioned a few times, all right? Okay, in the lobby at the Holiday Inn while they had the NAMI meeting. You see what we have to go through sometime. Okay, but one of the programs that was very dear to his heart was the Coping Sunday program. And as a minister, he did that for about 30 years. And the idea of the program was to increase the knowledge for the religious community concerning mental illness and what resources would be available in their communities and how to direct other people to those resources. So therefore, when he passed, he left donations for Urban NAMI in Cincinnati, as well as NAMI Ohio, and I will be making a donation for the Terry Russell Housing Project in his name. So I am very pleased and proud to present that scholarship to Samara Abernathy. I know you'll do him proud because he would have loved that you will work in an urban community to further education and foster that for the African American community involving mental health.
Hey y'all. I am a very, okay, let's just start. Hey y'all, I'm Samara Abernathy. I'm from Flint, Michigan. So that in itself is a field ground for me. So that's kind of where I got everything started. And it's more than just a water crisis. Like that's my home, y'all. Like that's where I grew up and where I learned what I do now. So shout out Flint. But also, art has been my thing. So whether if I'm painting on a canvas or if I'm writing down any poems or if I'm listening to music or whatever it is, art has literally helped me through, Lord, anything. Like I have anxiety, everybody, I have depression, all that stuff. And then without art, I probably would be who knows what. So once I got to Central and I realized everybody else loved art like me, I was like, well, cool. So to have a program, I had House of Amuse, y'all, and it was an art show that we put together, and I got artists together. They sold their artwork. They show how important it was to have art in their lives and what art did for them. So, man, y'all, I just did not know that I was going to talk. So sorry if I'm all over the place. But to have House of Amuse and to have that as my baby and to have Dr. Hunt and to have NAMI and all my students, like, I love y'all, and I really do appreciate it. So I'm going to stop talking, but thank you.
Great job, great job. For those of you that don't know, about 7 years ago, NAMI Ohio sent a delegation to Texas, and by the way, they didn't have to call me for bond money, to look at some unique programs. They were alternatives to incarceration, something near and dear to my heart, and long-term hospitalizations. From that visit, NAMI Ohio spearheaded the building and implementation of the Adam Amanda Mental Health Rehabilitation Center in Athens, Ohio. The building is named after Adam Knapp, son of one of our board members, and Amanda Baker, who was crucial to passing the assisted outpatient commitment legislation. Both of them lost their lives to suicide after being released from the hospital too soon. Although it's now 3 years later, NAMI Ohio's dream of 6 mental health rehabilitation centers in Ohio during the next 5 years is beginning to gain momentum. Most recently, NAMI Ohio submitted a grant request for an earmark in the federal budget, sponsored by Congresswoman Marcy Kaptur, the longest-serving Congresswoman in the country from my hometown, Cleveland. She has sent us a video that we would like to share with you today. Then I would ask Scott Sylak, Director of Mental Health and Recovery Services Board of Lucas County, to say a few words. Roll film.
Hello to our caring friends, members, partners, and advocates who are gathered today for NAMI Ohio's annual meeting. Every single day, all throughout Ohio, NAMI delivers on your critical mission to improve the quality of life of those living with mental illness in our communities. To the families and friends of those with mental illness, NAMI is an unparalleled source of wisdom, support, and guidance. For the last 40 years, wow, NAMI has shown as a beacon of light and hope in a space where darkness and loneliness may otherwise reign. Decades ago, as Ohio state hospitals shuttered their doors, our communities were not prepared for the consequences that would unfold. Mental illness does not suddenly go away when resources and programs disappear. Thankfully, through the hard work of NAMI and all of you, America has begun turning the page to ensure treatment is effectively and compassionately delivered in the settings and manners in which it is most appropriate. In support of this work, it has been my honor to help secure an additional $2 million in federal funding this year for a new NAMI residential rehabilitation center in Ohio. By properly treating those with severe mental illness, we can help ensure true recovery that endures over time. Finally, and this is truly a bittersweet moment, I want to congratulate Terry Russell on his retirement. For 50 years, Terry has worked tirelessly to care for those with mental illness and their families. His foundational legacy of service will live on through all of us through the ages, and we are ready to carry on the mission to which he has dedicated his life. I want to thank everyone gathered here today for the opportunity to share and reflect with you all. As you continue your service to the people of Ohio, please know that I'm here for you in whatever manner I may assist. Together, I look forward to continuing the progress that we all know is possible. Thank you.
Well, hello everybody, I'm Scott Sylak. A little bit of an audible. I thought I was actually going to introduce that video, but thankfully that was a good change because I didn't have to follow those incredibly talented people. And I was starting to wonder, what the heck did I do wrong to piss Terry off to follow such great performances? And so thank you for bailing me out on that one. And congratulations to you young folks, that was just fantastic. So I'm here today to talk a little bit about a joint project with NAMI Ohio and the Mental Health Recovery Services Board in Lucas County. You all know it as the Adam Amanda House in Southern Ohio. We're calling it an adult psychiatric rehabilitation facility up here in Lucas County, mainly because we can't find the name yet that is going to settle for us. But like the NAMI Ohio board, my board strongly believes that residents of Lucas County and throughout the state that have gone to a state hospital need more than just a limited stay without support coming back into the community. It should be treated like any other physical illness. If you break a hip, what happens? Frankly, nobody break a hip here, especially Terry, but you go to a rehabilitation facility, right? That's what we want to see for every community in Ohio. Lucas County is proud to hopefully be the second facility to be up and running in Ohio. We strongly believe in the concept that will reduce the revolving door of not just state hospitalization or private psychiatric unit hospitalization. There was a young lady here earlier that talked about that revolving cycle. And folks, we live it every single day. We see it every single day. Terry calls all of our board directors every single day about that type of issue. And this project, this opportunity has the ability to dramatically improve outcomes related to crisis and hospitalizations and long-term recovery. I'm proud to say that my board has put up $500,000 for the project, and of course we're amazed that we received the $2 million that NAMI Ohio received for this project. One thing I do need to mention though is we love Congresswoman Kaptur. We love sharing her with Cleveland, but she's a Toledo girl. So she lives in, and we, there is Congresswoman Kaptur is a huge advocate of mental illness, especially the high science around mental illness. She's always asking the higher questions. about mental illness. And she is a true advocate, and we are so proud to be the recipient of those funds. And of course, we need to thank the state of Ohio Department of Mental Health and Addiction Services, because they are supporting this project as well. We have named this project a priority in our Ohio Moss Capital Grant, so that means another $750,000. And we are working out a long-term lease for state land on NOPH, our state psychiatric hospital land, so that you can literally walk out the back door of our state hospital and into this new unit. We are moments away from hiring a owner's rep. We're building ground up. So we think the project's going to be about $6 million. And Terry has committed to attempting to assure, I won't put too much pressure on you, that this project be mortgage-free. But this project is happening with or without additional funds at this point. We are so excited, and of course I would be remiss in not mentioning the success that Terry had throughout his career and continues to have throughout his career of service. And we should all be so lucky as to retire among friends. So thank you very much, and thank you, Terry, and thank you, Luke. And I need to mention another person here, Sally Lucan of Lucan Solutions, who's been a big part of our project moving forward. Thank you all.
I would like to call on Helen Jones Kelly, Director of the Alcohol, Drug, and Addiction and Mental Health Board of Montgomery County, to say a few words with a big announcement, and also present the NAMI Affiliate of the Year Award.
All right, thank you so much. I am so thrilled to be able to be with you all today. I've sat over there in that part of the room, and I have been just so invigorated by the energy, the compassion, and the caring and dedication in this room. So I do have a couple of things that I want to share back with you today, because you've given me so much by allowing me to be with you today. I don't have a prepared speech, but I did jot down a couple of notes, because I was not going to get a side eye from Terry for taking too much time. I will be brief, but there are a couple of things I want to share with you. There have been some themes that I've heard throughout the day. Certain words keep resonating about what happens with NAMI, and especially with Terry's leadership at NAMI. We've heard the words compassion, committed to helping people live up to their full potential, caring, and we've heard the need for housing. We've heard that there are still gaps in our system that prevent people from being able to live up to their full potential. And much of that really is around some of those supportive services that not a lot of conversation occurs about, but it does now because of the housing initiative that carries Terry's name. And I am thrilled to be able to be here to share some things with you connected to that. But I have to tell you a quick story, because when Rick Keller did his Terry impression, we were really quiet, y'all. And we know that that was a great impression, right? It was dead on, that's right. So I was sitting there and I started chuckling into my shirt too. And I was reminded of just over a year ago, it may not have been that long, Terry invited me for a personal tour of the Adam Amanda Rehabilitation Center. It was to happen at, I think, 10 a.m. I arrived at 10:11. My personal tour was halfway done before I got into the building, because as we've seen with Terry today, there is a thing about punctuality. And I had gone down one of the wrong lanes by the time I turned around and got back. He was on mission. He was moving through. But that, too, illustrated who Terry is. He is tenacious. He is compassionate. He is focused. And in that process, he had me at hello. So one of the things that I want to share with you today You heard that there are 6 planned pieces of this initiative. I'm going to ask my colleagues from Montgomery County NAMI just to stand next to me for a moment as we share this, because in Montgomery County, everything is done in collaboration. And our NAMI office in Montgomery County is in the board offices. We work together in everything that we do. And so, Terry, we have a gift. On behalf of the Montgomery County Adamus Board and Montgomery County NAMI, we're going to be your 3rd initiative. We're bringing a rehabilitation center online in Montgomery County. I'm telling them to stay here because I have one more task, and I'm doing it timely, Terry. But this one's really exciting because I have been asked to do something that brings me great honor. Like I said, we work collaboratively. That's kind of if you look in the dictionary, that's Montgomery County. We tend to do a lot of these things together, and I have had a chance to work very closely. I think there's something in the water for the CEOs with NAMI, all of them, because Linda Stagels, our NAMI director, is likewise persistent, unrelenting, compassionate, and present, always present. But y'all know something else? So is her board chair. And there's nothing like being called into a meeting with these 2 fabulous women and having results come about as a part of that. And their leadership has made such a huge difference at the local level. But today, I have the wonderful honor of presenting to you the NAMI Ohio Affiliate of the Year Award for 2022. So thank you. And Terry, I don't know if you're allowing them any time to say anything. That's on you.
Well, as the board president, I am so surprised at this and so thankful. I'm just flabbergasted, but I'm so thankful that Terry and NAMI Ohio supported us, and that Helen Jones Kelly of Montgomery County has supported our wish. So I'm just so thankful for everything, and thank you all for all that you do.
As I look around the room and I see all my fellow affiliate partners, I know that you know the work that we do every day. And I know that you understand how important it is to be collaborative with our mental health partners. But I mean to tell you, I've worked at a lot of places and I've never seen the type of collaboration that Helen Jones Kelly provides through the Adamus Board. And we have 80 plus providers. And it's been my privilege and honor to be invited into those meetings. So thank you, Helen, for allowing us to be part of your plan for the future. And for NAMI Ohio, I can't thank you, Terry, enough. You got on board, you helped us create the vision that we've seen, and we hope to provide the rehabilitation center for all those who need it. And we can't afford to have another person turned away from mental health recovery that takes a little longer than 3 to 5 days that the insurance companies cover. Okay, so thank you very much. Thank you for this honor. And
well, I am truly honored to introduce our next speaker. Dr. Lori D'Angelo is the executive director of the Magnolia Clubhouse in Cleveland, Ohio. Shireen Mehta runs the Pathway Clubhouse here in Columbus. Lori has been on the NAMI Ohio Board of Directors for a number of years and makes sure our focus is always on those we serve. Lori and Shireen have also brought a number of Clubhouse members with them, and we welcome all of you here today. We're glad you're here. Dr. D'Angelo?
Thank you so much. We're going to start with a video, and then we'll go from there. At least 1 in 5 people experience mental illness every year. Less than half get treatment. And when people do get treatment, it primarily consists of medication.
The Clubhouse model offers people living with mental illness opportunities for friendship, for employment, housing, education, and access to medical and psychiatric services in a single, caring, and safe environment. Clubhouses are cost-effective. 1 year at the Clubhouse costs less than a week in the hospital.
People come to a clubhouse and they're needed, and they work in partnership, members and staff, to operate the club. Having that purpose facilitates people's recovery and also is a natural mechanism to build relationships and creating a community. The Clubhouse model fills a void in the mental health system.
I'm a psychiatrist. My job is to make sure your diagnosis is right and make sure I'm treating the symptoms so they create the least barriers and the least limitations on you possible, or create the least distress. That's actually a tiny part of what helps people recover and helps people live the lives they want to live. The rest of it is figuring out how to re-engage in life in a way that makes sense for you. It's recapturing that sense of purpose. The Clubhouse is doing all that. It's helping people actually reconnect with what it means to be a human, what it means to imagine a future, what it means to be part of society.
Life before Clubhouse was very challenging. It was lonely. I felt depression, anxiety. The impact that it's had on my life is just doing, seeing, and believing in myself in a different way. First, I kind of came with the idea that I wanted to socialize with people. I didn't want a job. I didn't want to do those things. And literally in a few months, that perspective all changed. Because I was like, well, if all of these people here can work and they're engaging and doing these things, why not me? It gave me such confidence that I don't think I would have been able to tap into if I hadn't come to the Clubhouse.
Life before Clubhouse was very chaotic. I've always seemed to have anxiety, depression, mood disorders, and starting at 14, you add up all the years, it was really scary and frustrating. I didn't even think I'd be here at this age. I was convinced I would be gone before I was 18. Because of what I've learned about myself through the Clubhouse, through the people who come here, the people who work here and everything's changed. Every day I have hope, which I never thought was possible in the past.
I began the journey to start a Clubhouse because I have a son who was hospitalized. Hospitals are great, but they send you home and you're isolated. And every Clubhouse I called wanted to help me. The amount of support out there from Clubhouse, Clubhouse International, the Cleveland Clubhouse. Without the Cleveland Clubhouse, we would have never started Dayton.
The Ohio Clubhouse Coalition, it consists of 3 clubhouses: Pathway Clubhouse, Miracle Clubhouse in Dayton, and Magnolia Clubhouse in Cleveland. We tasked ourselves with the mission of growing the clubhouse footprint. There should be a clubhouse in every city. You know, it certainly changed my life, and it can change your life too.
On behalf of Clubhouse International, we are excited and look forward to partnering with you on your journey to start a clubhouse in your community. It'll not only change your community, it'll make your community a better one, reduce costs of emergency rooms, psychiatric hospitalizations, involvement in the forensic systems. This model, the Clubhouse model, is an evidence-based, over 70 years old, proven model. We're really looking forward to working with you. Come join the club. Help us change the world for your community and for communities all across the globe.
Join the club.
Join the club.
Join the club. I did.
Thanks, everybody. And can I ask all of the folks here from Clubhouses, we've got Magnolia Clubhouse over here, and Miracle Clubhouse and Pathway Clubhouse over there. Could you just stand up for a second? Where's Cleveland? I don't know where they are. Maybe they're over there. Oh, they're over there. So they're all over there. But we really appreciate the opportunity to be a part of this seminar today. And it's such a privilege and honor, and there's so much good work and such a rich history. Thank you, Terry, for your leadership. Where'd Terry go? He's way down there. Oh, thanks, Terry. We wouldn't be where we are without Terry's support for this model and for NAMI Ohio's support. The members of the board have heard me talk about this and have come to visit and have been very supportive of helping see this model grow in Ohio. And again, we wouldn't be where we are without you and the staff of NAMI Ohio as well. We've had the support, fortunately now, of the Ohio Department of Mental Health and Addiction Services, and they have provided startup funding of $2.7 million. And that has led to 7 startups across the state of Ohio. And it's just beginning, and it's in Cincinnati, Marysville, Delaware, Youngstown, Geauga County, Kent, and Ashtabula. So we are adding to the 3 existing clubhouses. We've been meeting regularly. There's a training coming up. We have a director for the coalition, a staff position, who can work with us and be full-time focused on this growth. And we're very excited to spread the word across Ohio. So we're hoping there'll be more opportunities in the future. This was a new thing, and but there's been a lot of support. I don't know if Tracy Plauk is still here, but Tracy and the department was very supportive during the Medicaid redesign process so that Medicaid funding can sustain this model in Ohio. And Lori Chris and the department have been the reason that we're at the point we are today. So we wanted to make sure you all knew all about it. We've got some brochures out on one of the tables that give you contact information, and we're happy to come and visit, have you come and visit us and do everything we can to have more clubhouses in the state. And I want to let Shireen, who is a member of Pathway Clubhouse, come and share. You saw her in the video, but I would like to also ask Shireen to share what this process is like for you as a part of it and what your thoughts are.
Hi, my name is Shireen Mehta. I've been in the mental health system since I was 14 years old, and I'm almost 60, so it's like that's all I've ever known is growing up being mentally ill. I've been part of lots of hospitalizations, cycling in and out for decades. Day treatment programs were effective to the point where it gave me a place to go, but I never got better. At the time, that was just the place I needed. But when I started getting better was when Pathway here in Columbus started trying to follow the Clubhouse model. And until they did, in around 2000, the longest I'd ever worked was 3 months. And it's been 4 years for the longest one I've had. And that wouldn't have happened without Pathway and the Clubhouse model. And it doesn't mean that every day is good, because every day is not good. But I have some place to go where people understand. I work side by side with other members there, as well as the staff. We're all on equal footing. It's not like a day treatment where I'm told what I have to do, where I have to go, and everything. I'm treated like the adult I am. And I'm given respect, and yet we all care about each other. At Pathway, we call ourselves a Pathway family, and that's what we are. We're just like a family to each other, and we're always there for each other. And if you can drop by here in Columbus, please do. It's at Champion Abroad. We'd love to give you a tour.
Thanks, Shireen. And I'll just add that the roots of the Clubhouse model, it started in 1948, and it was started by people discharged from a psychiatric hospital that wanted to help each other, and they banded together to help each other get back into the community. And they initially called themselves We Are Not Alone. And you'll hear these themes as all day we've been celebrating what we're all about, and this is it. And it's exciting to see our system starting to evolve and develop with practical solutions and needed resources. So I want to thank all of you for your part in it. And also, it's, I think, such a promising time for the future. It was so exciting to see all the young folks involved and creating more bridges so that we know it isn't all of us that have been around so long that we want to stay in the loop. But we're happy to pass the torch and see all the youth involved in creating what we go forward with. Thank you.
Just a little housekeeping. In your program, Youth Moves is next, and she's going to introduce you. We're not having the last section. It's my staff, and you don't need to hear it for them. Basically, we're running out of time, but Youth Move has all the time that we're on the program. So I don't want the Youth Move not to think they don't have all the time. Oh, I forgot Michelle Martin. Why don't you do it?
Okay. All of us as a society, COVID was a tremendous blow to all of us. And during this time, it was also a call for social justice. The NAMI Ohio Board of Directors recognized the disparities of healthcare in underserved communities. The mental health system could be a poster child for the disparities in our society. With the help of the Ohio Department of Mental Health and Addiction Services and their faith-based initiative and COVID assistance, we have been able to start a number of diversity programs. A leader in this movement is NAMI Franklin County. And today, Rachelle Martin, Director of NAMI Franklin County, will tell us what they're doing to further social justice.
Well, good afternoon again. So I would like to talk to you about our Faith Link program. In 2013, President Barack Obama introduced community conversations on mental health. In Franklin County, over 20 community leaders under the leadership of NAMI Franklin County came together to discuss youth and faith-based mental health. During the same time, a faith leader brought to the attention of the community leaders the need for mental health and substance abuse care for pastors, clergy, and faith leaders. Over the past 10 years, the Adam Board of Franklin County, in partnership with NAMI, introduced the Faith-Based Symposium. Pastors, clergy, faith leaders, and faith leaders. Over the years, we have discussed suicide, mental health, substance abuse, self-care, anxiety, depression, trauma, anger, and stress. In addition to the faith-based symposium, NAMI Franklin County began providing mental health first aid to the community. Currently, we have provided mental health first aid to over 29 churches. Under the Adam Board's new leadership, we have begun Phase 2, entitled Faith, Hope, and Healing, Bridging Our Temples. Now, the new project, the Faith Link, we are introducing it under the, in conjunction with OMAS. We have 4 pilot churches in Faith Link. The project provides support and resources to faith leaders, first responders, and/or gatekeepers. Faith Link collaboration will facilitate access to mental health treatment, raise awareness of the prevalence of mental illness and its impact, reduce trauma associated with receiving mental health treatment. Faith Link is an opportunity for mental health professionals and faith leaders to work together towards improving the quality of care for individuals facing mental health challenges. A therapist has been assigned to each one of these churches to collaborate with each participating congregation. The therapist will be assigned to the congregation and will collaborate individually and confidentially. So this is our project. We are going into churches, providing therapy services to the congregations, and NAMI Franklin County will foot the bill. So thank you for allowing me to talk about it. But before I go, just one more minute, Terry. I would like to have the NAMI Franklin County staff stand up. These human beings have grace and humility, and I want them to be recognized today. So I would like to say something to Terry. Terry, I thank you for your leadership, for pushing me to be the leader that I was designed to be. You have been an outstanding force in my life and in the NAMI Franklin County staff and their lives. May God bless you, and I hope to see you continue with the housing project, and NAMI Franklin County may one day give you some money towards your housing project. Thank you.
Thank you kindly. From your lips to God's ear, or the legislature, or whoever has to hear it. So I won't say we saved the best for last, because that would be rather rude to all the other presenters. But we are so blessed that years ago, we recognized the voice of youth needed to be heard. We took over the YouthMOVE program, and so many young people are now participating at all levels of the mental health movement, so their voices can be heard. Today, we have Amber Glendell, John Delick, and other YouthMOVE state leaders to present their work. I think you will enjoy this presentation, and at the conclusion of that will be the end of our conference, and then we'll see you all back here at 6 p.m. this evening for dinner, dancing, and whatever else Terry has planned. I think ice cream sundaes. Okay, take it away.
Good evening, everybody. All right, so I am Tykees Cox. I am a graduating senior from Franklin County. I attended the Charles School at Ohio Dominican University. I am the Franklin County NAMI YouthMOVE's lead, and I am going to get our presentation started today. All right, so I joined NAMI to help my peers find the support that they needed. My life hasn't always been easy, like many other people. I believe that if we create spaces for youth that are considered low income and inner city to have the opportunity to be creative and completely themselves, you will notice a change in them, because with the help of my mentors, I found myself through poetry. Child, find your purpose. You've been feeling lost your whole life until your mentor says you need to go soul searching. So to find your reality, you need to look in. I think to myself, what would life be like if I decided to throw away the mirror? If I stopped and just listened? I think to myself, what would life be like if I danced and danced and danced? Sometimes I think to myself, what is it going to take for me to make it? I think I just want it all to go away. The pain, the hurt, the neglect, this powerless feeling like I'm gasping for air, like I'm gasping for air, like I'm gasping for you. No one, nobody. Why didn't you tell me it would be this hard to preserve my mental? Why can't I just love myself and be happy? Why can't I just love myself and be, I'm talking, let my love so higher than a kite. and let my spirit be swallowed by the warm embrace of me. My talent is more than enough. Now why can I be? It hurts to have a gun pointed to your head when all you wanted was a peace of mind. Please don't kill me, whether that's homicide, suicide, or genocide. I know that it's a black man's job to never let your spirit be destroyed. And black girl, how do you do it? Smile. So big is that the definition of black girl magic, the ability to be hurt, broke down, hurt, and still smile. Hurt, broke down, hurt, and still smile. Black women have changed my life. So don't numb my pain, because I'm ready for a change. I'll show my heart to the people that I'm supposed to. I'm learning to be grateful for every beautiful day that I'm breathing. And every hard one that I'm living. My anger will no longer consume me. My spirit will seek harmonies with me. No more senseless fights, nor physically, nor mentally. My flaws don't look so bad. No longer shackled by the weights of my insecurities. I am free. I finally found my place in humanity, so I think to myself, what would life be like if I was just to be? And are you still running? Are you hiding from your fears? When was the last time you thought to yourself, in peace?
Amazing as always from Takis. My name is John Ball, and I'm going to be delivering a poem about YouthMOVE's policy agenda with state lawmakers. YouthMOVE, I've been a member since I was in high school, and for those of you who aren't familiar, YouthMOVE is a mental health advocacy group which supports the behavioral health needs of youth, multi-system youth across the state of Ohio. And politicians, if you need a photo shoot, we've got you. Our youth are so photogenic. You can see them around the room. The only thing is we're going to talk to you about our youth peer support agenda while it happens, if you don't mind. As a team, we work to make sure that all youth, regardless of their history, resources, or challenges, are valued equally and included in every aspect of our work. And we're led by Angela LaRiviere, who works tirelessly to empower youth across Ohio to share their experience, their testimony, and support each other. And our work includes providing youth voice at the Department of Mental Health and Addiction Services to develop mobile response and stabilization services, or MRSS, along with Ohio RISE, which is a model in which a team of trained mental health first responders meet youth and families who are in crisis where they are. This will help NAMI partners connect families to better options for youth, reduce emergency hospitalizations, give youth access to immediate behavioral health services, and reduce behavioral health calls to police. Now, another big victory we are celebrating is the creation of the first ever state certification of youth peer support in Ohio. For the past 10 years, we've worked endlessly with state partners to bring peer support certification to Ohio, and we're now training young adults age 18 to 30 to be certified specialists. In each of these settings, we've had youth providing input at every stage in the process. These youth were navigating jobs, school, and mental health struggles of their own, and they did it because they believe in the mission of NAMI and care about developing a stronger Ohio for youth. I joined NAMI to help my peers advocate for services and supports to help multi-system youth around Ohio, and to expand my support network. YouthMOVE, along with my family, was there to empower me when recovery wasn't going as quickly as I wanted it to. It was there to empower me when I found out it would be a 6-month wait before I could get the treatment I wanted. It was there to empower me through the struggle of dealing with health insurance coverage. And this year, despite my personal mental health challenges, I was able to graduate from Harvard University studying neuroscience and public policy to work for organizations like NAMI. And that wouldn't have been possible without YouthMOVE support, especially during the pandemic. So thank you so much, and thank you to all of NAMI. And now I have the honor of introducing someone who's been working as hard as anyone I know during the pandemic. Please welcome YouthMOVE leader and peer support lead, John Delick.
Thank you, Ty Keys. Thank you, John Ball. Hello, everybody. My name is John Delick, and I'm a YouthMOVE Ohio peer leader and a board member of YouthMOVE National. I would like to dedicate this presentation to one of our youth leaders who is no longer with us. Jerron would have been 29 years old today, and he passed away, unfortunately, due to sickle cell over the pandemic. So please join me in a moment of silence as we remember him as well as others that we have lost during this time. Thank you very much. And now I would like to take a couple minutes and tell you about all the awesome work that we've been doing at YouthMOVE Ohio in support of the work of NAMI. All across Ohio, our youth leaders are out here every day, advocating, doing community service, teaching and supporting others by using our own lived experience to promote mental wellness and beat stigma. We provide training to our partners and peers. We advocate and bring awareness through media and advocacy like our resiliency ring. We build community gardens, help run peer centers, support local NAMI walks, and sit on many state advisory boards. Additionally, we provide leadership training and opportunities to young leaders. With all of that, as you may have heard, we have been dealing with a very unique challenge over the past couple years. Well, a little thing like COVID isn't going to stop our youth leaders at YouthMOVE Ohio. Some of our proudest accomplishments have actually taken place throughout the pandemic. The very first week of COVID, we developed a 14-day stay-at-home healthy challenge, which was accessed by 20,000 people online. Soon to follow, we sent out 1,200 hula hoops and 2,000 frisbees to youth to help them stay active during the pandemic. We also distributed over 1,000 care cards, 400 care packages, and 500 t-shirts to youth all across the beautiful state of Ohio. And last, but certainly not least, we started an online support group over Zoom that helps youth continue and provides a safe space for them to go. And we continue to do that even though we're now coming out of the pandemic. As an original Zoom leader on those meetings, one of my favorite things to do was what we call random dance parties. And I'm sure a lot of you know how Zoom fatigue can set in. And so once that starts to set in and our leaders start to perceive that, what happens is we'll play a random song. And what you have to do is you have to stop, get up, and dance. And it breaks the monotony of those Zoom meetings. And now, YouthMOVE Ohio has a special treat for all of you. And know everyone will be coming around. Thank you.
We must believe that won't stop giving all we got. Don't give up, never give up. We won't stop giving all we got. We're breaking away from what holds us down. And this could be the day that puts out the light. Now we're marching on with the will of never giving up. And this time we're the one without a fight. We must believe that if we give, we will receive. Yes, we must believe that it's gonna get better. Don't give up, never give up. We won't stop giving all we got. Don't give up, never.
Okay, thank you, YouthMOVE leaders. Thank you. If there's anyone who hasn't received a care package, you'll get that at the end of our presentation. I want to thank you again to everyone in YouthMOVE for helping to put out our special deliveries for you all, and I hope you enjoy your packages. If you find that these are things that you can pass along and somebody might benefit from them more than you will, we encourage you to do so and let them know that they have friends here at YouthMOVE Ohio. My name is Amber Glendale McClendon, and I am a leader from Cuyahoga County, currently working in the NAMI, Ohio office with Angela. We want to thank you for taking the time to learn about what YouthMOVE does. Now that you have heard from us a little, you will meet our amazing leaders. As I introduce them, I want you to think about how you can utilize the youth in your communities with your local affiliates. We do a lot of work at the state level to support our local leaders and partners, and we are lucky to have a great team of youth who are trained and willing to come in to work with the NAMI offices as their schedules allow. The state team consists of myself, John Ball, who was our first presenter after Tykees, John Delick, who came up before me, Chantel Smith, John Stewart, who couldn't be here with us today, Kaylee Dillon, Sasha Bowers, Nevaeh Fernan, and many other youth leaders who make themselves available when needed. Additionally, all of our youth leaders contribute to our work throughout our bi-weekly leadership meetings. Next, I would like to introduce our Zoom support team. This team started as a temporary support to youth as a way to navigate the COVID shutdown. But by popular demand, they continued. Check out our website for the support Zoom schedule. Our support Zoom leadership includes Ripley Myers from Wood County, who could not be here with us today, Elizabeth B. from Wood County, Chantel Smith from Summit County, and Sunshine Brown from Clark County. Next, we have a special shout out to our Youth Peer Support Curriculum lead, Kaylee Dillon. And please give her a round of applause. Kaylee works 4 to 5 days a week reading, revising, and helping write youth peer support curriculum while kicking butt in grad school studying to become a doctor. So go, Kaylee. Yeah. And finally, I want to introduce to you our brand new team of YouthMOVE regional leaders. These leaders are working to strengthen our NAMI partners and our youth councils all over Ohio, and we are so happy to have them join our team. First, Gianna Pepino. Gianna is our Northeast regional leader based in Youngstown. Next, we have Nathan Biggers, Nathan is our Southwest Regional Leader, working with Gloria Walker in Cincinnati. Then we have Grace O'Neill. Grace is our Northwest Regional Leader, working in her own YouthMOVE office at NAMI Toledo. Then we have our beautiful poet from earlier, Tykees Cox. Tykees is a Central Regional Leader working from NAMI Franklin County, and he graduates tomorrow, so give him a round of applause as well. We have Ashley Karsten. Ashley is the West Regional Leader and Director of Peer Relations at NAMI Clark Green, Madison. Then we have Zach Geen. Zach is our newest member to join the YouthMOVE team. He is the East Regional Lead, working in Zanesville with NAMI 6 County. And last but not least, we have our superstar from the North, Kyrese Brooks. Kyrese is our North Regional Leader, and he is an avid NAMI supporter, prevention educator at Lacataway in Lorain County. As you can see, we have a strong team of youth leaders who believe in the mission of NAMI and want to support the work that you do. Some of our goals as we move forward include to strengthen our youth participation and support the work of our NAMI affiliates, to promote ending the silence being taught in all schools, to support the expansion of the NAMI on-campus groups, providing training for youth peer support certification, continuing to develop and promote crisis resources like MRSS to families and youth, and to use our voice to be strong advocates for services and support for youth all around Ohio. Remember, youth can bring a unique perspective and great energy to the work that you do. Make sure to reach out to our leaders, who are here behind me, and together we will work to make sure that NAMI Ohio and our network is able to remain the strongest and best in the country. Now we will let our Franklin County Youth Leader, Leliana, literally wrap it up.
Good afternoon. I'm a little short, so I'm sorry if you can't see me in the back. Everybody enjoying themselves? That's what I like to hear. That's what I like to hear. I will literally wrap it up for you today. I got a rap for you. This right here is a youth move. NAMI also made an appearance. They here in the room. I just want to say I appreciate everything y'all do, giving us the opportunity to be great and be leaders too. We trying to make a difference for our community. Growing up, I ain't never had these tools or the key, and recently we just had a resiliency ring. I was a guest speaker, got on stage and I speak. Thank you, Angela, for giving me the confidence we need. One thing I can say, we really out here chasing dreams. I'm talking about peer support trainings and everything, and also the mobile crisis response team. If it wasn't for NAMI, don't know where I would be without it. They kept me on the right path. For example, I'm in college, and if you ain't noticed, right here is the NAMI conference. Thank you for having us. We gonna show you how we about it. We got care packages. Here they come, pass them out. We worked hard on what we put in it, inside and out, 100%. Guarantee that that's no doubt. I'm proud to be a part of this journey. Thank you, Terry. We're gonna continue the legacy, so don't you worry. We still got your back through whatever, helping people in a hurry. Enjoy your retirement, because we gonna miss you surely. To do all the NAMIs doing what you do, y'all doing an amazing job. We standing behind you. Y'all are living proof that we can really make a difference. And I'm a youth, but I got a lot of experience, so thank you. Thank you for all that you've done. Thank you. We standing under the sun. Thank you. NAMI, here we go, stand up. This is the NAMI conference, guarantee we gonna rise above. Thank you. Thank you for all that you've done. Thank you. We standing under the sun. Thank you. This is the NAMI conference, so we gonna rise up, and then guarantee we gonna rise up above. Yeah. Oh, you guys touched my heart with standing up. Tykees, would you please join me, please? We got one last thing to do. Sorry, you guys. You want to do the example or you want me to?
I can do it.
All right. He's going to give you guys the example.
All right, so what this is, it's a call and response. So when you hear, we're going to say something, and then we want y'all to say, the word should be up on the screen. And we're going to do this. We're going to show y'all how we do it, and then we're going to turn it to y'all. All right, so we are
Friends.
We are
Family.
We are peers. We are family. We are.
I think we was going a little too fast. That was just an example. We're going to do it slow. Yeah. We were just as example. Sorry, you guys.
My bad.
All right, here's the real deal this time.
We are.
We are.
We are.
We are. I don't think so. Thank you guys for that. We tried. The screen was a little late. You're welcome so much. Enjoy your retirement. Thank you.
Look at this. This is a future.
Thank you.
I don't have to worry about leaving. We've got these kids.
Sir.